cause, but it's not in exactly the same place as a true lumbar spine, low back pain. So we'll skip that. But muscle strains and sprains are the most common cause of low back pain. And the myofascial pain is the development of those tight muscles, and you can get knots in them where the muscle fibers that are near each other can stay contracted for so long that they become painful in themselves, and then they create their own little chemical milieu, and they become their own pain source. And that is chronic myofascial pain. So when people talk about knots in their muscles, if you can feel a knot, that's most likely this is what we call chronic myofascial pain. And you know, if it's chronic, most people who have an acute injury, an injury just happens, you know, all of a sudden. They aren't developing this chronic myofascial pain right off. They may have muscle spasms or really tight muscles, but they may not develop the knots in the muscles for some time. But if things heal up quickly and they're doing good things for their body, then they can sometimes avoid developing this chronic myofascial pain. And then arthritis and disc degeneration, very common, and we will talk a little bit about those in a bit. I did want to just have one mention on the slides about uncommon causes of back pain and the serious causes. So if you have back pain that lasts more than 2 weeks, you should at least probably go and see your regular medical doctor. They will evaluate you there and make sure that you don't have anything that could be really ugly, you know, like an infection, tumors, you know, bad things. And so if you have numbness or fevers, chills, I've had patients who had back infections for months and had no symptoms but a few little chills. And you know, they got treated with pain medicine and muscle relaxants and physical therapy, but sometimes the only thing you'll find is a little bit of chills, and you don't notice as adults who takes our temperature, right? And then weight loss is commonly associated with tumors and those other things. And then, of course, trauma. If you have some trauma and it's pretty significant, you wind up with a lot of pain, go sooner to have an evaluation. Okay, so muscle strains and sprains can come about, of course, from moving that shelf across the floor or carrying something heavy up or down the steps when you probably should have waited until somebody else came home to help you. Repetitive and awkward motions. When the researchers want to study some of these issues, they just ask the students to do something over and over again. In about 30 minutes, they can produce a tight muscle and the beginning of a strain or a sprain. It doesn't take very long. And again, the anatomic variation. If you have a little bit of a curvature, and quite a few of us have curvatures that don't bother us, some never, and some people may have a mild curvature that doesn't bother them until they're in their 60s when, you know, maybe if they had a straight spine, maybe they wouldn't have developed that. There are other people who have a little bit more of a curvature, and they might develop pains a little bit earlier. And part of that pain is that the muscles working really hard to pull us up. And so if the muscles are kind of fighting against these curvatures in the back, and it also depends on whether the person is trying to maintain good posture or if they're just slouching into it or maintaining a position of comfort. It eventually takes a toll on the muscles, so they become, as I said before, their own source of pain. You know, this can be mild to severe, and a lot of times people will develop spasms, which is different from, spasms are different from a tight muscle. A tight muscle might just be a constant source of pain. And spasms that, you know, I mean, everyone's had one, but you know, it takes your breath away sometimes, or it might even move your limb around or cause a muscle or joint movement. Those kinds of things often heal on their own, but not always. And you know, when you've had back pain, anybody do anything without a doctor's or a physical therapist or nurse practitioner's advice? Eat, rest, ice, Tylenol, ibuprofen. Those kinds of things work on most of these muscle strains and things. But sometimes what caused it in the first place, especially if it's a poor posture or repetitive or awkward motion like performing on a regular basis. Sometimes we need some help to get out of that, because once you get started, it becomes this vicious cycle, the snowball, or the vicious cycle. And sometimes we need help to get out of that, and that's where all the providers here come into play to give you some advice. So the old adage that you should rest when your back hurts has really been soundly thrown out the window. You may need to have light to moderate activity, or very light activity for a day or two, but after that, you need to start moving and do whatever it takes, whether that be heat or ice, or some kind of intervention. You need to get up and move. That's really what's going to help to break that vicious cycle, keep it from going further down. Again, the anti-inflammatory meds and the gentle stretching and lower back exercises are the thing to do. So this chronic myofascial pain, it's one of the things that I treat most often in a pain clinic. And again, the trauma, you see a pattern here. Some of the things that cause low back pain that can irritate different structures and still cause pain in the same area. So when you go to see someone and say, oh, my back hurts right here, there are a dozen different structures that could be causing that. It's evaluation to figure out what's causing it. But I do find that a lot of times the myofascial pain gets missed. And again, once you've held yourself in a non-anatomic position for a while, whether that be because of poor posture or the way that you're built, or an occupation, which you do on a regular basis, sewing, computer work, after a while the muscles are irritated, and they're doing what your spinal cord is telling them to do. So it's not always an inflammation issue. So that's sometimes why ibuprofen doesn't work very well on some of these muscle things. Sometimes it is if it's a strain or a sprain, then inflammation does have a role to play. But then you'll find that the anti-inflammatories that are a little bit more helpful. But if it's just this chronic myofascial pain where the muscles are doing what the spinal cord is telling them to do, and they're contracted in this odd, uneven manner, then they become their own source of pain. And it can be pretty severe. And in some cases, the nerves that run between these muscles can become pinched, which causes more symptoms. And it's a vicious cycle. So going to somebody who can find these knots and either massage them out, you can do some stretching. Stretching is a good preventative measure, but it doesn't really help you if you're really in a severe pain kind of situation. You really kind of need somebody to put their elbow in there and massage it out. One of the things that I haven't found very helpful are muscle relaxants. A muscle relaxant is very good at relieving a spasm, but it doesn't really get into those little knots in the muscles, those few fibers that are kind of close together that are all ganging up on themselves, and they just cannot relax. And so I don't find medications very helpful for those. The trigger point injections at the bottom there, that is something that I do, and it's not really related to acupuncture as we understand acupuncture, and who understands acupuncture, but a lot of people do. But I mean, I think scientifically we don't still really understand exactly how it works. But the needles that I use to treat these trigger points, the size is fairly similar to some of the larger acupuncture needles. So I tell people that because it's comforting. But the additional treatment with the poking these things with the needle involves putting a little numbing medicine in. And different pain clinics, different providers might put other things in there. But really, what's been studied most is just a simple little bit of local anesthetic, which forces those fibers to relax. You can rub them out and do all kinds of things, but they can just snap back together. But if you chemically relax them, I find that really helpful. And sometimes that's what's needed to kind of get started on breaking that vicious cycle. So we'll go over those just a little bit more. Then the other big cause of low back pain is disc degeneration and arthritis. And We don't have a lot of good therapies for disc pain. Disc replacements that, is Dr. Sparks here? I need to know if he's here before I say anything about orthopedic procedures. Okay. Even the orthopedic guys who speak at the pain meetings admit that we just don't have a good solid replacement for discs. The disc therapies that have been done are all over the map. Everything from kind of cooking the things, you know, deadening the nerves inside the disc, putting things in the disc, taking things out of the disc, taking the whole disc out and putting a little mechanical thing in there, sticking all kinds of things in there, and none of them have really turned out to be really good therapies. And none of them have been shown to really reduce pain reliably. So that's the whole thing. You want your spine to be stable. You need a stable spine. So if there's too much movement where a disc is, there's got to be something about that. But reducing the pain is a whole other lecture. But it's a difficult one. So posture, strengthening your core, as was talked about before, you need all those good muscles to help hold that spine into place. And your spine is designed to have curvatures at a certain angle in certain places. And when we have muscle spasms, or we have, crummy posture, or whatever we're doing, or if we have scoliosis, which is not within our control, after a while, these discs take a hit for that, because they are designed to be in a certain space, with these vertebrae lined up in a certain way. And when the vertebrae don't line up that way, they put pressure on the front or the back or the sides of the discs, and they become flat. They don't cushion as well. They don't soak up water at night like they're supposed to. And that's one of the big reasons that we lose our height. It's not necessarily because our vertebrae have shrunk so much, it's that our discs shrink. And so that's the first thing that generally happens. Lots of other things happen, and one of the things I just would like to mention is that discs don't always start out with a lot of nerve endings inside them. But once they become a little bit degenerated, a whole range of chemical reactions happens to encourage nerve endings to grow into these discs. And that's one of the biggest problems with disc pain, is that they're not supposed to have all those nerve endings in there. And so once they've done that, because they've been irritated for years, that pain's kind of tough to get rid of. There's no surgery that's going to get rid of that. And sometimes people just have to rely on a little bit of medication when, after they've had all the physical therapy and good posture improvement and core strengthening, they can stand. So, and believe it or not, the low impact aerobic activity is very good, even for people with disc pain. I'm talking about running, but there are all kinds of good machines out there now, and walking is time-honored good aerobic activity. And one of the things that does for us is not just the strengthening the muscles and all of that, but it changes our chemical milieu in our system. So it helps to our body to naturally quell some of that inflammation, which helps our pain. It helps the body to say, okay, we're not going to produce all this all these chemical mediators that cause the nerves to grow into places where they shouldn't be. So that's, you see the same advice all the time, lose weight, exercise, core strength, but there's just more and more lovely science to stand behind these things. It's ever so more complicated than we ever thought. Okay, and then the radio frequency treatments is, so of course, these are our discs, and this is truly what happens. Maybe that's a lot uglier than this, but this is what happens to our disc. Now, another really common cause of back pain is these little joints here, They are called facet joints, but that's where arthritis occurs quite a bit. And we have a lot of good treatments for those. Of course, the same things apply: fitness, core strengthening, good posture, little aerobic activity. But these radio frequency treatments that I mentioned down here at the bottom, and we'll talk about those a little bit more. But it is possible to put a little steroid, a little cortisone on these joints, but it typically doesn't last very long because these joints are not usually hollow anymore by the time they're arthritic, so you really can't get the medicine in there. And so the thing that we do in the pain management world is we just stun the little nerve that goes into those joints. And that lasts for a little while. There's a reason that we just stun it and we don't kill them. I'll just tell you now. You know, when someone has an amputation of some sort, frequently most people know that you can sometimes still feel that limb, or you can still feel pain. That can happen to any nerve in the body. So even these little nerves that go to these tiny little joints that are really not much bigger than our finger joints. And so when we go in there, people used to freeze them, cut them, and sometimes that phantom pain would happen. You'd still have the same back pain that you had before. And that's even more difficult to treat because it's more of a nerve pain rather than just what the pain level we think of as regular pain, inflammation, soft tissue pain. And so stunning these nerves with this radio frequency, which is just a means to heat the nerve up. There's some disagreement in the researchers' world about whether it's the heat or the type of electricity, but either way, it stuns this nerve for a period of 6 months to a couple of years, generally. And so that's how that's treated, and also just management of other conditions, you know, such as diabetes, stress, a little bit out of that too. All right, so there's all kinds of things that we can do about our back pain. And we'll go these are some physical therapy, of course. Core strengthening, the posture improvement, the food therapy, all incredibly important. Because, you know, if you had a lot of back pain and somebody told you that second day to go out and take a walk, you know what you're going to tell them to do, take a walk themselves, right? Because if you could do that, you wouldn't be complaining, you know, you wouldn't be complaining about this pain. So there are things that we have to do to sort of mitigate the pain before you can tolerate some of these therapies. And I think food therapy is one of the most brilliant ways to do it because it just takes the whole weight business out of the picture, just about. The electrical stimulation that was spoken about before, there are other types besides the transcutaneous electrical stimulation, the PEG, the percutaneous. Do you guys do that percutaneous? Electrical pens? You do TENS? Do you do the pens, the percutaneous, the neo ones? No. Who wants that? Right? Yeah. And general strengthening and conditioning, aerobic conditioning, all excellent things that you can do. Reducing stress, really, really, really important. You know, by the time you've had stress, because maybe the pain has started the stress, you know, maybe that's the problem, but whatever the cause, stress generally causes us to tighten our muscles down, and if you have muscles that surround a joint, and they're all contracted and tightened, what are they doing to that joint? They're smushing the joint together, so the joint has to have a little space in there so it can have some circulation, do its thing. And so reducing stress is incredibly important, and I really like the whole idea about the yoga and Islamic religion, you know, it's a movement technique. There's a lot of good research showing that it's incredibly helpful. I think mostly because it's slow. It's a little bit like Tai Chi, but it's so much more available than Tai Chi. It's slow and it encourages people to breathe. And okay, so the trigger point injections. The medication again is a little bit of local anesthetic or numbing medicine, and you don't have to use that. You can just hook these things with just the needle, and it can be helpful. But I find that people feel better right away and more quickly using a little bit of local anesthetic. So it's sort of like three therapies. You've got the local anesthetic that's putting those fibers to sleep. And when I talk about a knot, sometimes they're no bigger than a lentil, and then sometimes they feel like they're as big as a marble or bigger in some folks depending on the muscle. So the easiest place to find one, if you want to find one on your neighbor or yourself, is right up here in the middle of your shoulders. You can almost always find a marble-sized knot right there, and it's not a bone. That's a trigger point. And they don't. Just because they exist or that you have one doesn't mean it needs to be treated. But it gives you an idea that maybe you probably should look at your posture and stretch those once in a while. Typically they'll develop into something. Not every trigger point that this has to be treated. It's not painful then it doesn't need to be treated, but it's sort of like a little warning sign. So anyway, then the radio frequency treatments, we talked about that already. If you have any questions about those. The integrative therapies, the massage, chiropractic, acupuncture, the special body work, therapeutic yoga, the relaxation techniques, all very, very helpful for many reasons and not just stress reduction. Medications, these are not the first things you run to. Maybe Tylenol, ibuprofen might be, but all medications have side effects. Tylenol's not that easy on your liver. Ibuprofen and Aleve, those are not that great for your kidneys. You can take a lot. If you need it and your kidneys and your liver are good, then you should take it. We're talking always about not diving into that vicious cycle and just kind of circling down and getting into a behind the eight ball. There are lots and lots of medications. Not a lot of herbal supplements for this technique. There are some, and there's some research. And at the end, I'll leave the slide up. There are a couple of websites that you can check. Dr. Wiles' website, actually, and then the Mayo Clinic website. Those are the two best ones to look up into herbal treatments. They'll list any randomized controlled trials and any good research that's associated with those supplements. Surgery for low back pain is usually not indicated if the pain is localized to the back. Again, you don't have the, so I won't say anything too negative about this information. But, we just don't have a really great, reliable, this is the best thing, since sliced bread to do for this pain. So you usually will not find anyone who will just operate just for back pain. If the pain radiates to your legs, that's a whole different story, and another lecture. But the back surgery is generally very good at relieving pinched nerves that are causing leg pain, and there are all kinds of research studies out there that compare people who had similar disc problems or back pathology, comparing those that had surgery and those that didn't, and generally the agreement is that after 5 or 10 years, the outcomes are not much different. There's still the same percentage of people that have pain, the same percentage of people that don't have pain, or somewhere in the middle. So that's a last resort. And extra weight aggravates all causes of back pain. And this is the last slide. So staying active, it doesn't take very much. Just walking 20 minutes. That's really not that much. De-stressing, making sure that you're doing something every day if you have stress to kind of relieve that. It's never okay to slouch. That's how I got myself to even stand up straight 30% of the time. Good nutrition, some strength work, taking breaks and changing positions. Even if you do have to work at a less than wonderful workstation, getting up and changing positions, doing some good stretches, learning what to do. And there are all kinds of great websites to tell you what to do, bending and lifting correctly, taking good care of your back if you already know that you have some degenerative disease, and getting good rest. That's a good part of de-stressing. And I'll leave these websites up for you to have a look at. And the book that's listed there is one that's recommended by Dr. Mindy Walace. So I can have a look at it. Well, if you look at this triangle and the low back where people have most of their back pain, there are many structures in that small area that can be pain generators, that can be the cause of that pain. You would think that if you put cortisone on these little joints down here, that if there was if those weren't the pain generators, if something just a quarter inch away was the pain generator, you would think that cortisone would go that far and do some good, but it doesn't.
This is not cortisone, this is a trigger point.
Oh, trigger points. Oh,
Yeah.
okay. Well, you know, not every, like I said, not every trigger point is a cause of pain. They can exist nearby each other and not be causing pain, but you can have several trigger points in one area and inject one, and if that's not the primary trigger point, if that's not the main pain generator, you can actually aggravate that one and cause more pain until you get that one done, you know. So we don't know everything about trigger points, but I'd say when I do them, I don't do very many at a time so that I can have some idea of which ones are really the causes. And then if I do a little small area and the person doesn't get much pain relief, then I know those really aren't it. I need to go somewhere else. And I know, you know, sometimes patients just want me to do this whole giant area of their back all at once, and I tell them there's just no point in that. You know, you'll never know which ones are really the culprits. And so, yeah, it's a diagnostic challenge sometimes.
But do you feel, the reason I ask is, one time I had it and it was miraculous. It affected an area that was far, far larger than the injection. I thought I'd been cured of back pain forever. But you won't be able, you'll just have to ask me whether that happened. Is that right? I mean, if you treat someone, you don't have any way of knowing whether you'll be helpful, really helpful, or not helpful at all.
Well, that's one of the advantages of putting the local anesthetic in, is it works right away. So I may have someone who has just generalized upper back pain, and I'll do what I think are the pain generators. I'll do maybe 2 or 3 of those, one side or the other, and I'll sit and talk with them for a little while. In 5 minutes, they'll say, oh, that's so much better already, or, oh, still there, you know, and that's how you know. And then I document that. I say, okay, I don't need to do that big one in the middle strap. I need to do this rebiter over here. It's not that far, but it's a different muscle. But that's the one that's really causing the pain. So take your time and do it, and sit with someone, and you can figure out which ones they are. And where's the pain on your foot?
Pain is on the outer side of my left foot, like above the left side of the left foot.
And the only problem that you know with your back is if you have a compression fracture at L1, or, yeah. It's possible that they're related, it's probably not likely, but you need someone to evaluate what's going on with your foot. And is that coming from your back? Is it coming from your foot? Is it coming from your shoe, the way you're walking? You know, all of that kind of thing. You need somebody to look at all that.
PC thought it was related because of the back, and she gave me a number of different types of exercises, plus I do the ones that I got here, as I said, 20 years ago. And up until a few months ago, the ones I got here were doing fine, and the walking and so forth, and now it just seemed to rest. 2 months up at that. And it only happens when I'm driving my vehicle.
Sitting.
I don't use my left foot to drive.
Yeah.
It doesn't hurt to walk for the most part, although now and then if I turn it just the wrong way, it'll hurt. But it does drive me crazy at times.
Yeah. Maybe you know, you should talk to your primary care doctor about, you know, having a look and really figuring out what is causing the problem, and then he or she, you know, is not able to do that, to send you to someone who can make that evaluation. You may need another you know, image of your back to see what else is going on. When people are sitting, it's that posture thing again. This part of your back likes to be in this position here. So what happens when you sit? You're pushing these 2 sacrum and your bottom vertebrae together. And what does that do to that disc? That compresses the front part of that disc. These discs are, you know, as we get older, the jelly that's in the disc gets stiffer, but it can move around a little bit. So if you're compressing that part, where's that jelly going to go? It can only go out to the back. And that's where your nerves, they think that's their spot, you know? And if the disc goes out there, they're in somebody else's backyard. And so that can put pressure on the nerve. Or sometimes just sitting, you know, I hear that a lot about driving, and I think it's like bucket seats, you know, where it's not like sitting in this chair here, you're flexed just a little tiny bit more, you know, in a
You
car.
have a back support, right?
That might even cause you to, if be more flex at the hip and this junction here, so yeah, all that.
I will ask you next, at my next appointment. I'll do the exercise in the meantime.
Good.
And keep on walking.
You know what, it helps an awful lot of people. I don't keep up with all of it, I mean, I can't, and, you know, there's research on both the little clicker thing that they're using these days. Dr. Weil thinks that there's a place for both the old dynamic thrust thing and the little clicker thing that they're doing. He thinks that's great for the elderly. He wouldn't want to do a dynamic thrust maneuver on them. And, you know, but there's so many other things that chiropractors do, and I just haven't kept up on them. But when I have a patient that says, I love my chiropractor, and every time I go to that person, I feel better for 2 weeks or a month or whatever. I go back to them a couple of times and they straighten me out and I'm good to go. And I say, keep going to that guy or that gal. They tell me every time I go, I never get anything, and I go 5 times a week and, you know, 20 times a month, and I don't get anything out of it. You know. Or, you know, if somebody comes out of there and they're paying for a week afterward, then maybe that's not the right treatment. You know, if they make you feel good, I think that's fine. You know, because that could even be a de-stressing thing, just a relaxing thing for the mind. And, you know, you ask all the mothers having babies, does this rubbing thing on their belly do anything to them? Oh yeah, well how could that, you know, how could that be something that is helpful? But it is. We're just so much more complexly wired than we think. So. Not unless you're sitting in it for a long time and it's not a good posture. So the last thing I'd like to say, my time is up, but you know, the balance between getting the exercise and doing the core strengthening and the pain, there has to be some kind of balance there. Yes, it's easy for me or someone else to say, oh, just push through that. You've got to get your core strengthened, you know. So, and you know, and I hear in the pain clinic, well, I can't do that because it hurts too much. So there is some kind of a balance there that where we have to kind of push through some pain, but you have to really be guided on that kind of pain. There are pains that you shouldn't be pushing through, you know. So seeking, you know, good advice from the healthcare providers is the thing to do. But there are some times when you are going to have to push through a little bit of a pain. There should be